Hi, my name's Dr. Alex Perry. Welcome to the Perry Centre, Canberra's natural fertility and women's health clinic. And in this little video, I wanted to talk to you about women's health specifically, and perhaps some areas that you might be struggling in and would like some help, particularly if you are seeking a natural approach to women's health, Some of the main areas that I kind of treat, in terms of women's health, and let's list them and then we'll dive in and I can talk a little bit about them. The first one is period pain. We deal with PMS, with breast pain or discomfort, particularly mid-cycle, around ovulation or perhaps close or during your period. Endometriosis, which is a real problem in our community for a lot of women and not well treated from a Western medical perspective. Perhaps you've got really heavy periods, or perhaps you've got no periods at all. You might even be struggling with menopause. There's a whole range of things that as a woman affect your life in a way that it just doesn't affect me. But I've got daughters and I've worked with women over many years, and I think that in some ways I may be able to help. Let's break this down and talk a little bit about some of these issues and how we can deal with them. You'll find that there is a timestamp below this video, so you can click directly to the point in the video that you'd like to visit that is relevant to you. But let's talk a little bit about period pain. Now, period pain and endometriosis we could perhaps put together because the outcome is very similar, and it's pain generally during the time of having a period. Now, it's not always the case. Some women get pain at ovulation, some women get pain prior to the period, and I've met women who've got pain that it feels like it's day in, day out throughout the month, but it's still related to your cycle. Now, whether it's for a day or half a day or an hour or for a whole bunch of days during the month, period pain can be debilitating. It can be debilitating because it can just put you off your game. It can make it hard to do the sort of things that you want to do. Perhaps it's going to school or playing sport or going to work or whatever it is. And it can be excruciating to the point of not being able to leave home. Now, period pain is one of those things that I think that we kind of, from a medical perspective, we consider to be normal. And for a lot of women, they're told to take some painkillers and a hot water bottle and stay home or go to bed or soldier on. And I just don't think that's necessarily the appropriate response to a significant and ongoing condition of pain, and a regular condition of pain as well. Now, I'm not going to pretend to have all the answers or to be able to solve period pain or endometriosis in all cases, but I have over many years walked with women who are struggling with pain, with period pain. And in the majority, in many of those cases, that pain improves significantly. And that has a massive impact on general well-being, your ability to work and to function normally. So if you're struggling with period pain, whether it's sharp and stabby pain or whether it's a dull, achy pain or a kind of I've heard women describe period pain like it feels like their uterus is falling out. Whatever pain you are experiencing, if you'd like to try a natural approach, then can I recommend acupuncture and Chinese medicine. Now, Chinese medicine has been around, some would argue, historically about 5,000 years. Now, it's been around a long time. That doesn't necessarily mean anything other than that it's, to some degree, tried and true and well tested. And I've been doing this in Canberra since 2006, and in 5 years of training prior to that. So it's been a big part of my life for a long time, and working with and helping women is my passion. So if you're struggling with period pain or endometriosis specifically, I'd like the opportunity to try and help you to resolve or make some improvements to your pain. So if that sounds like you and you'd like to have a conversation, there's a couple of things you can do. You can hit me up for a 10-minute on the phone conversation, talk it through, give me a quick, what are you feeling and how's it affecting you? And we can talk very quickly about how I can help. If you're ready to make an appointment, if you'd like to come in and give me a chance at improving your period pain or your endometriosis, whether it's pain as a standalone or whether it's part of trying to fall pregnant, either way, you can make an appointment. The booking button is at the top right of this website, and I'd love to I'd love to help you if I can, and certainly we'll talk through your options, and you can make a decision as to whether you proceed with treatment. Breast pain is not an uncommon condition. So if you're struggling with breast discomfort, now it may be at ovulation time, it may be at period time, it may be at both, it may be outside of that. The first thing I'd say is make sure that you are up to date with a breast exam from your GP. Okay, that's the first thing. Make sure everything is as it needs to be. Okay, so if you've got lumps, if you've got pain, make sure you're up to date with those exams. And of course, you can do a whole bunch of self-examination, breast self-examination, and there's good information, again, from your GP, how to go about doing that. And that's a really important self-care tool that you need to be on top of. Now, let's say you've got breast pain, you've been checked out, you're up to date with your screening. Then breast pain can be related to hormonal fluctuation throughout the month, mid-cycle, end of cycle, period time, and it's something that does often resolve or improve significantly with Chinese medicine treatment. So if you're looking for a natural approach to make an impact on breast discomfort, and that seems to happen in a couple of ways. It can just be a sense of fullness and distension, but some women have significant pain throughout their breasts or different parts of their breasts, on the outside, the inside, or the whole thing, somewhere in their cycle. So if you'd like help with that from a natural perspective, then I just encourage you to come in, let's talk it through and see what your options are. Now, a period will vary significantly between all women, and it's interesting. As a bloke, I don't have obviously the experience that you do as a woman in terms of what a cycle's like, but it does seem to me as a kind of an outsider looking in that sense that a lot of women don't talk about their periods very much. So they don't know whether they've got a heavy or a light, or a medium. That it's hard because it's not something that women typically compare, although certainly there are exceptions to that. But I'm thinking in this case about two sorts of cycles. One is a very heavy cycle. Now, if you've got a very heavy cycle, it could feel a little bit like you're hemorrhaging every time you have a period. If that's the case, that's unhelpful. If you're bleeding like that, and you're bleeding like that for a number of days, and I see women who are bleeding, in some cases, for weeks like that, then you are losing an awful lot of blood, and obviously the nutrients that go with it, and the body fluid and so on. So eventually you can end up potentially with iron deficiency anemia just because you're bleeding so much. Now, as a bloke, if the other blokes, men in your life, were bleeding like you are, if you're bleeding heavily, I certainly be looking for the emergency department and probably a transfusion. So to take it lightly is, I think, a mistake. So if you've got really heavy periods, heavy bleeding, can I recommend that you try and find a solution so that you are losing less blood, and perhaps have an opportunity to put some of that blood back into your own body, into your own blood bank inside yourself. That's really, really important for your health as a woman. So I just encourage you, if you're struggling with heavy bleeding, that is something that I may be able to help with. And in my experience, a Chinese medicine approach, which is a natural approach in the sense that we're not going to be using a pharmaceutical type approach or a physical approach, and like a marina or a rod in your arm or a pill or something like that. We're going to take a much more natural approach to try and encourage your body to stop shedding quite as much blood as it is. So if you're struggling with heavy periods, can I encourage you to at least book in for a conversation, and then we can talk through your options. Now, of course, the opposite of that is amenorrhea, which is no period, and a lot of women struggle with not bleeding at all for a whole range of reasons. And I don't know if you knew this, if you're not bleeding or not having a cycle, and you'd like to have a cycle, I think it's important that you do as a woman. It's a normal part of your physiology to have a regular cycle. There's two sorts. One is called primary amenorrhea, which means that you've never had a period. Now, this is pretty uncommon in my clinic anyway. Certainly is out there. So if you've never had a period, and you are perhaps more than 16 or 17 years old, then this is something you should really talk talk about. The other kind, and it's much more common, is secondary amenorrhea. In other words, you've had a period at some point, you may have even had a really regular cycle, or it may have always been irregular, but you haven't had any bleeding for 3 months or more. And it's amenorrhea, in other words, amenorrhea, not bleeding, no blood, no cycle. And that's again, I think it's something worth looking into, particularly if you're considering fertility or having a baby. You really need to be having a cycle in order for that to happen. So if you're looking at it through the lens of fertility, it's really important. And even if you're not, I think having a regular cycle is an incredibly important part of your physiology as a woman. And that gives you an opportunity for your body to replenish itself and to keep that cycle going. So if you're struggling with not having a cycle, then can I encourage you to make time to have a conversation and we can talk through your options. I don't have the magic bullet or the magic treatment to flick a switch and get you having a period again. But in my experience, a lot of women who've had a period in the past will have a period again with a little bit of help. So I would just encourage you, if you're interested, particularly in a natural approach to reinstigating, kicking off a period again, then I would really encourage you to reach out. And it's interesting, women who've got really heavy periods really don't want to be seeing that period at all for a little while. Women who are not having a period, haven't had a period in some months, in some time, really appreciate it when their period returns. So it's quite a dilemma in terms of having too much or not having it at all. I just encourage you that if you're not having a cycle and you'd like it reinstigated, please reach out and we can talk through your options. Menopause is something that affects, every woman at some point as they come to the end of reproductive years, and it's a normal passage of time. There's nothing unusual about menopause. It's just a stage in life. It's a season, if you like. So talking about menopause is really important, because I think what happens often is that in our Western culture, we push ourselves so hard. With stress and work and family, and our kind of work life or our life balance gets a bit out of sorts. So whether we're men or women, we're just being pushed often as far as we possibly can be. And I think that at points has a detrimental impact on our health. And menopause is one of those things for a woman. So particularly if you have a history of heavy bleeding or a number of children or other aspects that are leading your menopause to be pretty strong. In other words, hot, bothered, night sweats, not sleeping well, the whole bit. If that's you, if you're struggling with menopause and you'd like a natural approach, then perhaps I can help. It's certainly worth a conversation, because from a Western perspective, there are not too many options other than hormone replacement therapy. And I'm pretty wary, I have to admit, about putting hormones, someone else's or external hormones, into your body. Now, there's a time and a place for it, for sure. But I don't necessarily believe that it's always the right approach. So if you'd like to try a natural approach to improving your menopause, then I'd love to help you. I have to say that, this is one area where Chinese medicine, from a gynecological perspective, really excels in treating or helping women with menopause. And I've seen this through my own patients and through the clinic, that women who are struggling, feeling like they're losing control of their bodies because they're burning up, they've got night sweats, it's affecting their ability to sleep, therefore it's affecting their mood, then oftentimes we can do a lot to cool the situation down. And if we can do that, it makes a big impact on that kind of mental health, physical health, every aspect of your well-being that can improve if we can get some of that heat out of your system. So I just encourage you, if that's you, if you're struggling with menopause, reach out, let's have a conversation, and we can talk through your options. Or, of course, you can book in. There's a booking button on the right-hand top of this website. You can book in online, and I'd love to help or to serve you, particularly if you're struggling with menopause. So that's really a rundown of some of the conditions that from a women's health perspective we can help with. So if you're looking for a natural approach to improving your health as a woman, then I think that we can help. So if you'd like to get in touch, a few ways to do it. You can call me directly, 61624950. Reception will be more than happy to make either an appointment for you to come in or even a 10-minute chat on the phone, and we can talk through whatever questions you've got, so you can determine with all the information at hand if this is the course of treatment that is best for you. I should say I don't have any magic bullet for any of these conditions. What we do have is the opportunity to use some specific tools to make some physiological change in your body to try and improve your health and your well-being as a woman. So if that sounds good and you'd like a conversation, please reach out. It's my pleasure and my privilege to serve the Canberra community, women and their families, since 2006. And I'd love to help you if you'd like my assistance. Anyway, I hope you find what you're looking for. Get in touch, and I look forward to meeting you in the clinic real soon. Until then, my name is Alex. This is the Perry Centre, Canberra's home of natural fertility and women's health, and I look forward to meeting you soon. Bye for now. Well, thank you so much for watching through to the end of the video. I hope that you found what you're looking for, whatever you're struggling with. I'm hoping, from a women's health perspective anyway, I've given you some answers or some ideas of how we go about treating some very particular conditions here at the Perry Centre. If you're ready to make the next step, I've made it really easy. It's just a matter of hitting the big button directly below this video. It'll take you to the booking page, and really look forward to meeting you really soon.